We're like an actual celebrity and people are trying to meet us.
All right, we live, y'all. What's up? Welcome to the cookout. Hey, hi, with the
Hey.
aunties.
Hi, everybody. That's me code switching. Let me stop.
Please stop.
Really? Okay.
That's our next episode, y'all. Code switching.
Well,
Make
how
sure
we
you watch
start?
it.
Like in case
Yeah.
they don't.
Well,
Okay,
let's
so
see.
we already know we're gonna be answering some questions. Eating.
I wish I was eating.
I ain't got no food. I already ate.
I had to eat.
I won't eat
I had
till
a po' boy.
I meant to get some food and I did not. My fault.
Well, if anything, we know our husbands are gonna be. We got 5 people in here, y'all. Let's get it.
Hi,
It's
Ash.
four of them is
Five
us.
people.
Ashley Green is on here. That's our
Hi,
friend.
Ashley.
That's our best friend from home.
I don't see
Ashley.
any of them.
You can't see anything?
No,
Look.
I don't.
Okay.
Hi.
Oh, hi. That's how y'all made it. Okay, girl.
My daughter's watching too. Hi, Zeph.
Hi, Seth.
Oh, my dog.
Oh, is that the oldest one, Ashley?
Yes, that's the oldest
The one
baby.
that stole your face?
See, I don't think she looked like me. Everybody say she looked like her daddy.
I think she
She
like a
looks just like you.
Like
Just like
exactly.
you.
That's why I thought it was you. I was like, is this wait a minute, what? I was confused. I was so confused.
All right, let's see who joins in.
So.
All right, well, go ahead, Shiggy.
Oh, no, you go ahead. I was about to say we should probably get a topic out there. Maybe they'll start asking questions then. Well, I mean, it's only us on here right now. But
we can wait till more people join. Right now, we got Zeph and Ash, and we can wait. I say we wait until a couple people join. Maybe, people be running late.
Well,
Hey.
I had a question and I just lost it. I remember.
Oh yeah, we do have to remember that this will be visible after the live, like it's being recorded and it'll stay up.
I do have a pretty good clinical question that maybe y'all can answer while we ain't doing nothing.
Okay.
So, OCD, right? What is your what do you do? What is your go-to practice? Your go-to intervention for OCD?
Mine is CBT.
Okay,
and behavior modification.
But what's one of your interventions?
Well, behavior modification. I just see. I'm not gonna do good on live, y'all, because this ain't gonna be good. I can't.
You will do fine.
Talk.
Hold on.
So
That ain't a lot of people here. Hold on. Right back.
When I say behavior modification, it's more of like positive reinforcement for or behavior replacement types of things. So you have somebody who, for OCD, for me, if whatever they're doing is not interfering with their daily functioning, I don't tend to focus on that. So if they got to cut the lights on and off 5 or 6 times, but they still getting to work on time and they still able to function at work, and like I don't make that a huge deal. But if it's something that's like really causing them a lot of distress, then sometimes I'll look at replacing the behavior with something that gives them a similar feeling.
Yeah.
Or positive reinforcement for doing it less. So what's the term when you, like with substance abuse, when you like kind of wean the person down instead of just telling them
harm reduction?
Yeah.
Yeah, harm
So
reduction.
it's more like, okay, if you have to flick the light on 5 times before you leave, let's try 3. And then you reward yourself when you're able to do that 3. So that's more of a behavior approach that I use. But
I'm gonna try that because what I did was I did a replacement. I replaced the behavior. It's like profuse head scratching, like scratching holes in the head with like something else to do with your hands. Like, okay, you like to draw, so in school you can doodle while you like listening to the teacher. But I won't know if that's effective and for about 2 weeks. But
I read because I did have a client who dealt with OCD and we started doing exposure therapy. So something triggers OCD behaviors. So to find the triggers and actually expose them to the triggers can actually help reduce the behaviors.
Mm-hmm.
So
Okay.
that's an idea too. Another thing is TMS, but that's a referral type of thing.
What's
I don't know.
TMS?
TMS is transcranial. Oh, you're gonna have me having to look that up. It's something it's something one of my other clients actually did. It's a procedure that you go into and they like put these circuit things on your head.
Oh
And
yeah, I know what you're
yeah.
talking about.
So TMS tends to work for OCD, severe anxiety, panic attacks, depression, major depression. It can reduce the symptoms.
So we have another question here from Mr. Abraham Walker.
Oh, here he go.
And the question is, what advice do you have for someone that's considering being a mental health counselor or psychologist and choosing a school, brick and mortar versus online?
Who wants to take that?
I'll give it a shot first. So my first thing would be whether brick and mortar or online, you want to check the accreditation of the school. You want to make sure it's the proper accreditation. Like, is it K-CREP accredited? What type of accreditation do they have? Because that determines a lot as far as your career after you graduate. As far as brick and mortar versus online, right now we just live in an online world. We know, especially during the pandemic, we realized how important it is for people to have access to go to school online. It opens it up to a lot more people. It's usually cheaper than brick and mortar, so a lot more people can afford it. And there are online schools that are just as good as brick and mortar, because that was always kind of the thing that people worried about. Like, this is not going to be as good as if I go to school in a classroom, but it is. It's just as good. So you can choose brick and mortar or online, depending on how busy you are. For a lot of parents or people who work full or part-time jobs, online is the better option because it's more flexible. You can choose a part-time program and you can make it work for you instead of like trying to finish things in the amount of time that is designated for brick and mortar. You have more flexibility and more time.
Okay. And honestly, like right now, you'll get people from all like, the APA that kind of frown upon going online. However, brick and mortar, a lot of people don't have time to sit and hunker down in a brick and mortar school. People are working, people are mothers, people have whole households to provide for, and so they're depending on what you said, state to state. And I don't think I don't know if you already said that actually, but state to state. Like if I was to go to Texas and I wasn't APA accredited for a psychology degree, I could still get my PsyD because I could still get licensed as a PsyD in Texas because every state doesn't even recognize the APA. Some states recognize we just need the psychologist, period. And we prove that we can go online through a whole pandemic, and that the world could be online. So to me, it's becoming more obsolete. And as a bunch of people get out of the way with the older mindsets, it'll change slowly.
I want to add that it's important to also look into what type of counselor or therapist you want to be. I know the question hit on mental health counselor or psychologist. They tend to do two different things. Yes, they both center mental health. However, psychologists have a little bit more range of doing psych testing and things of that nature. So it's important to look at what specifically you want to do or your area of interest because there are different um, there's different things that each profession does. Social work, counselor, psychology, they all do different things. Like coaches, whatever.
Mm-hmm. Mm-hmm.
I agree with all of that. Y'all covered it all.
Amber is our producer slash director slash editor. So she on this live, like, I'm just gonna let them run this because I'm behind the scenes trying to do stuff, but her face is on the screen. So we gotta get Amber to talk.
I agree. I think the the baseline is like licensure, right? If you're going into becoming a mental health counselor or psychologist, I would assume you want to be licensed. So if the state that you're in accepts an online versus a brick and mortar, then that gives you more flexibility to decide for yourself whether you have the time and the funds to go to a brick and mortar school versus
Mhm.
online. But if you are in a state that does not accept online, then you can consider whether you want to move or not, or whether you want to figure that out there. So it's just licensure is is pretty much the one thing that will help you decide which one you want to do.
So um, Venetia asked a question. If you feel like you and your therapist aren't meshing well, how long and how many sessions should you give them before you make the decision to leave them?
Oh, that one's tough.
I think it's
I
very
think
cut and dry.
that's a cut and
You
dry.
think so? I think it's tough.
It's very cut and dry.
I want to hear what y'all got to say then, because y'all know I'm always devil's advocate here. But go ahead. I always
So,
feel like that.
first of all, whenever you find a therapist, it's just like going on a job interview for me. I'm interviewing you just as well as you're interviewing me. And so if you know from jump that you can't click with this person, or that there's somebody who is not listening to you, or is somebody that you feel like can't really grasp what you're really going through, because every therapist and every client don't mesh well, then you can make I would say make that decision after, maybe I would say, the third session. Now, sometimes you might know from the first session. Sometimes you might sit down and say, I don't think that this person is for me. But then, okay, maybe give them another chance to see, because maybe they had an off day. Maybe you had an off day. It's awkward the first time. But if you continue to go and you feel like it's just not working, or you feel like you can't grow, you don't want to divulge things to that person, or you don't feel like you're going to get you can feel if your growth is going to be stagnated, like, from jump, if you're in an interview like, this place is not for me, then it's okay to say, you know what, I really do want the therapy. Do you think that you can maybe point me in the direction somebody who might be better suited for me?
Mhm, mhm. Yep, I definitely agree. And this is where I also like to plug that even before you see a therapist, research that therapist. Most therapists have something online that you can read, or some people offer a quick consultation where you can ask certain questions. So even before you see that therapist for the first session, if you are looking for somebody that specifically works with anxiety, ask that question. Have you worked with clients with anxiety? If you are looking for somebody that is LGBTQ allied, ask that question. Are you LGBTQ allied? If you are looking for sex therapy, like, always ask for specifically what it is you are looking for first, so that way you can get that part out of the way. And I agree with Ati Shug. Within 2 to 3 sessions, you'll know if it's a fit. The first one, things could be off, could just be a rough day. Anything could be hampering the connection. But by the second one, you should know, okay, I think this could work. So at least 2. That's what I usually tell clients, like my couples clients who decide that they want to have an individual therapist. They always ask me, like, okay, what do we look for? I'll give them some pointers, and then I'm like, give it 2 sessions though, because a lot of times, especially people who've been in therapy before and liked their therapist, they look for that same therapist, and you are not going to get the same thing in any therapist that you got from another usually. So
Right.
that doesn't mean they can't work good for you. It just means they're different. All of us work differently. So give it at least 2 sessions before you call it quits, because 1 session is usually not a good determining factor.
hmm Helen Brown said, "Why waste time? Move on. You must feel comfortable." And I do agree that comfortability is a big thing. And a lot of times you will know in the first session if you feel comfortable with somebody or not. But also it could be you. And so it's never really a waste of time to try on your therapist in your sessions and see if this person works for me. Because sometimes you could be the person hindering your therapy. Like, if you don't like somebody's brutal honesty, then you have to figure out, well, why don't I like this person's brutal honesty? So in every situation, I always say, look at yourself and look at the other person, because you could be the one hindering that first session or the second session or the third session, and then decide.
Mhm.
I agree with that, and that's where I would have been coming from with the answer too. For one, if you feel like you and your therapist aren't meshing, I'm sorry, let me pause because Chandra just said I need to be able to express myself without the threat of locking me up. Let me tell your therapist is not a police officer, okay? They they do not like you. There's certain things that we have to report, we're mandated to report. But if you're telling us, you smoking a little something or whatever, you don't have to report stuff like
Right.
that. Sorry, that made me giggle. But yeah, so if you and your therapist aren't meshing, I would encourage you to talk to them about that too, because sometimes therapists are human too, right? So I have a very, very direct approach. A lot of my clients respond to that. I've had a couple that didn't, and it made them feel really uncomfortable. They told me that, and then I modified my approach to help them feel more comfortable. So I would say more than two. I say maybe 3 to 5 sessions, especially with insurance. And it just depends on what kind of insurance you have, because you can't always just switch like that. But I would say give them a chance because we're human too. Also, sometimes in the first session, therapists are people. So sometimes we get nervous when we're meeting new clients too. So if it seems like it's a little odd in the first session, it could be that you're both just a little nervous. And I know there's a level of professionalism for a therapist, but I'm gonna be honest, I get nervous sometimes too when I'm meeting new clients. But maybe after the second, third, fourth, and we're good. We're good. We're on a roll, and we don't have no problems. So it just depends on where you're at in the process. If you've been seeing that therapist for a year or maybe 6 months and y'all ain't meshing, yeah, go ahead and switch it up. But if it's only been, I don't know, 2 weeks, a month, and you haven't had a conversation with them yet, then maybe talk to them and let them know what's making you feel uncomfortable, and then see if it gets better from there.
Also, Amber, you made me remember something. When it comes to the one who said she don't want to get locked up, she want to be able to talk. I was crying when I read that. So there are a lot of things that you can talk to your therapist about that we absolutely do not have to report or put in our notes at all. You can ask your therapist not to put something in your notes. These are your medical files. If you do not want me to write down that you told me you smoke weed, I'm not putting it in there. I'm not. I can put other things in there. I can put client has a coping skill that may be unproductive. That nobody will know that means you smoke weed to cope with everything. So I can word it differently where it's not obvious what you actually said to me. And that's actually what we're supposed to do in our notes anyway. But if it's something specific that you don't want in there, tell your therapist that. But there are certain things we have to put in there. There's another question that came up about duty to warn. If
this goes with Chandra's question. It's pretty good.
It does. So she said, "Where's that
Hold
duty?"
on, are we skipping someone? Because I think
Yeah,
Ashley.
Ashley is next.
Ashley's next. We're gonna go back to Ashley's question. But who popped that duty to warn up? I think that might have been Abraham.
Yeah, so duty to warn. When you're in a situation where, first of all, therapy is confidential, but it has confidentiality has limits. So if you were, I will give you the best example. If you were to come in my office and say, somebody is hurting me, and you're under the age of 18, you're a child, then I need to warn. I need to call and I need to make sure that this child is safe. If you're over the age of 18, you're in a domestic violence situation, I can advise you until the cows come home and let you know that you're in an unsafe space, but your confidentiality is your confidentiality.
Mm-hmm.
If you are in a domestic violence situation and you are the aggressor and you tell me I'm going home and I'm going to shoot him, I can't take it anymore today, then I'm obligated to warn that person that this person is coming to harm you. Um, we above all we want to make sure that people are safe, and we want to make sure that you make it back to another therapy session. And the thing about duty to warn is it's also state to state. So we do have to look at the state laws, and every state has a different law. And so our state laws often trump our APA or ACA laws,
Our
our
ethics.
licensure board laws.
Yeah. And duty to warn, with it being state to state, that makes it very hard, because there are some states where you could tell your therapist I'm suicidal and they do not have to report. But in other states, they absolutely have to make sure you are safe. So they have to report. Homicidal ideation, suicidal ideation, harm to children or harm to elderly, we are literally mandated reporters. We do have to tell those things depending on what state we are in.
So don't hit your grandma.
Well, I swear they gonna think we don't like people grannies out here. It's
Oh,
all
they should.
grandmas.
She don't like grandmas because she always talk about them.
I loved my grandmamas. Let me just say that for the record.
All right.
All
So
right.
Ashley asks, what advice do you all give for someone who has a therapist, but there is so much turnover in their practice that with the therapist, and they have Medicaid, so they're limited as to where they can go? That's tough. So I actually just left a practice that had a lot of turnover with therapists. So if I'm honest, I don't really, I mean, if you can switch practices, if there's something where you can do it virtually with a practice that's further away, but you have a therapist that you can keep for longer, that might be my advice. I know if some people prefer in person, but switching therapists, a lot of it is really difficult. I've had so many clients that have came to me and have had like 3, 4, or 5 therapists within the past 3 months. It's ridiculous. So I would say if you can find someone that's further away and see them online, then go for that so that you can keep that person consistently and get the quality care that you need for a longer period of time. Anybody else?
Well,
There's a question.
there's another question from Venetia mother.
Okay.
We'll go to that.
I'll take this one.
Okay.
The question is from my mom. How do you deal with change or adjusting to your new normal after retiring? So I this is a tough question. I'm not retired, so I can't speak from experience, but I have did presentations in a church, and one of them was over grief and loss. And somebody mentioned in the presentation that they had retired, and it was like a loss to them. So they kind of felt like they were grieving, like they had worked 31 years in a place, and so it was kind of like they literally lost something. And so one of the losses that I teach about when it comes to grief and loss is like the your there's typical losses, and that's one of them. There's like off, what is it, maturational losses. So it's kind of like you growing out of a stage in your life. Typical losses, which is just like, again, retiring, that could fall under that. And then there's the offset losses, which is like an unexpected death of a family member, just things of that nature you're not really prepared for. So it sounds like with retiring, it's more like a typical loss. And so when you try to readjust to it, you may have to go through a grieving period when it comes to losing or when it comes to retiring, because it's literally a part of your life that you are now not a part of anymore, or things have changed. Um, and so adjusting to that could definitely much could definitely feel like you know not sure what to do, but there is I think power in grieving that old chapter, moving on to a new chapter. So if she is feeling some sort of like reaction to this, a lot of this is normal. And I would say normalizing some of the feelings that you're having with moving on from retirement. And that doesn't necessarily mean you have to just cut your losses and cut everybody off, because there could be colleagues that you can stay in touch with, old supervisors you can stay in touch with, but definitely allow yourself to adjust to those changes.
Um,
Keish.
I want to add to that, Keish, because that's some good stuff right there. And then like with retirement, sometimes if you are retiring, sometimes you don't want to look at the same things that you had the whole 30 years of working.
Mhm.
And so just getting rid of things, moving on to that new chapter in your life with a clean slate. Um, if you are a government worker, um, or sometimes, people in the Air Force, they have kind of like a shrine room. Put your things in a room. Like, this is what I did when I was in this phase, and now I'm moving on to a new phase. Um, you kind of have to meet yourself all over again when you retire, because you've been identifying with that one identity for so long that now it's time, okay, what's my new identity? What is the new thing that make me happy? Or what doesn't make me happy anymore? And so you kind of like have to date yourself all over again, figure out what you like, what you dislike outside of being in that certain role that you were in for so long.
Mm-hmm. I agree. This is an area that I've worked with a few older clients in who've retired. And I always focus on normalizing it, like Keish said, and showing them that this is a natural stage of development. We always focus on childhood development, but there are actual adult developmental stages. And this is one of them. So a lot of times I find that people who have retired who actually struggle with that change, it's either because they regret something, they don't feel like they accomplished everything in their life that they wanted to, and they feel like I'm retired, so it's over. Like I've been that identity, like Auntie Shug said. But there are other ways. You have to find ways to fulfill yourself now. Like you said, dating yourself again. What will fulfill me in this stage of my life? And when you find those things, that actually really helps that adjustment.
Not older clients. Some people retire at 37.
Oh, if you got it like that, they done boosted the retirement age to 72. It ain't even 65 anymore.
Dang. Well, military retirements.
Oh, right. Military get to just be, they get to be out here young. But for the normal civilians, if you still working at 60, 65, and this is when you're thinking about retiring, you have lived over half of your life working. So that is literally your identity. You don't know anything else. So you have to find those things that fulfill you and find a new sense of purpose.
And some military people have it hard because we're used to order, structure.
Mm-hmm.
And some of us, we go into the civilian world and they're like, why are people all over the place?
Why y'all jacked up out here?
Why is this process not working right? Why are people
Ain't
taking
no structure out here?
Y'all do that when military people do that when they still in the military. They
yeah.
To
And
live
so
with somebody in the
hard.
military, they'd be like, why this not in order? Why the bed not made right? What y'all
Why
doing?
they not standing in line right?
Like, if you don't calm down.
It's hard sometimes when military people retire and they get out, because then they're kind of, sometimes people can be at a loss. So you don't have to, always be at the maturation stage.
Mm-hmm.
Sometimes you can still be young and need to start something new. There's some more, Amber.
All right. So, how do you know, or what are warning signs you may need to talk to someone? This person's dealt with stress and trauma since they were younger and learned how to deal with it. For a strong person, it's sometimes hard to know when you need to take a knee. And it's also, to add to that, hard for other people to see when you need help as well. So she's a mom, boss, wife. Go ahead, girl. Miss Lamika, you better and sometimes she just assumes that tired is her normal. So what are some of those signs that you need someone to talk to?
Oh, baby, this sounds like Superwoman syndrome right here.
That's exactly what it is.
Get into it.
And let me tell you, Miss Boyd, first off, the first thing you said was, this may be a stupid question. No, honey, this is not the space for that. Any question you ask is relevant. And this one is really relevant, especially to us in particular as Black women. You literally are going through life tired, but feeling like you can't take your cape off because everything will crumble if you do. It won't. You are allowed rest. And knowing when to talk to somebody, you asking that question means you need to talk to somebody. If you can ask that question, you are already in the place, or have been in the place, to need to talk to somebody. And I'm one of those people that's like, everybody needs to talk to somebody anyway. That's just me, because it will benefit you even if you don't have any issues going on. Sometimes we just need to be proactive and get tools. We don't have to have anything going on or be extremely tired and exhausted and worn out to go seek a therapist. We really want people to realize that therapy is okay no matter what part of life you are in, but specifically where you are saying you asking the question, is probably time to go. It's probably time to seek that help.
And I would say, if you are experiencing some sort of dysfunction, like if it is impacting your functioning and the way you're living, like you continue to have like an increase in arguments with people around you, if you are starting to not be able to sleep, if your eating habits are, off, or if you can't concentrate, or your attention span, or you're just feeling exhausted or stressed more than the average that you would normally, then yeah, it may be time to talk to someone and reach out to someone to talk about that.
Another thing too to add to what Keisha's saying is that one of the signs of depression, and a lot of people overlook this because they think, well, that's not a sign of depression, is constant sleeping. So if you're constantly wanting to sleep, you're sleeping all the time, that's a sign that you might be depressed. Or if you can't fall asleep, can't stay asleep, or no matter how much sleep you get, you're still waking up tired, that's a part of that exhaustion.
Mhm.
And or sometimes I felt heart palpitations, and you might not recognize them as that at first, but you could literally be walking and it's kind of like your heart, you kind of have to catch your breath because your heart feels like it's jumping.
Mhm.
That's a sign of anxiety. And so for you to ask, when do I need to talk to someone, you're there.
Mhm.
And
And
let me just add to that as well. Um, those are definitely signs of some mental health disorders, but I would always encourage you to check in with your medical doctor as well to see if any of those signs are from a medical condition. Because
Yep.
sometimes the heart palpitations, feeling really tired, some of that stuff can be medical as well. And even if it is, that's also a sign that you need to talk to someone when your health is changing and maybe not declining, but it's just different and it feels different for you. That's something that initiates therapy as well.
Mhm.
and also recognize that certain symptoms culturally, oh, we got the baby on the line.
Mercy,
I
bless
heard
you, girl.
listen, with three of us mamas out here, so if kids walk in the room, it's absolutely normal. Okay. Um, but yeah, recognize that specifically being that I mentioned superwoman syndrome earlier, certain symptoms do not show up the same depending on your culture. So I want you to recognize that. Um, for example, you do have functional people with depression. You have functional people with anxiety, and they function at such a high level that nobody would ever think that they were dealing with anxiety or depression, and they wouldn't themselves. It's like, I'm still getting up, I'm showering, I don't sleep too much, I don't do, but it manifests and shows up in other ways. So don't think that the traditional criteria for a diagnosis is supposed to fit you culturally all the time.
And while you're on that, Auntie Ashley, can you talk about how it presents in Black women? We have a question specifically about that too.
Okay, so yep, I see that from Venetia on. She said we mentioned that stress presents differently in Black women. Can we touch on the differences? So a lot of times with Black women, specifically with my clients who are Black women, I noticed that for them, the stress shows up in perfectionism. The stress shows up in constant people pleasing. So if you struggle to say no, that is the way you handle stress. You feel like if I say no, I'll be more stressed. So you continue to say yes to everything. Everything has to be perfect. You feel like you can't relax. You can't take a day off. You are so highly stressed but avoiding it that it shows up as over productivity. A lot of Black women, it shows up as over productivity. You, if you meet somebody, you say, "Girl, she always on the run. She can't never sit down. She always doing something for kids, doing something for her family." She probably really, really stressed, but she is not going to outwardly show that.
Mhm.
So when you see someone that is constantly having to do something, they never sit still, that's a problem too. That means they do not understand that rest is necessary.
I will also add, in literature and in research, it shows that Black women tend to suffer physical health declines. So our stress can show up in heart attacks, cancer, and strokes. We are the leading cause, and it's because of stresses that we take on and how we present it. But we don't see it as stress sometimes. We just keep going, and then next thing you know, we have these physical issues, but we haven't really understood where the origin of this stress came from or even figured out how we even got here. So
Mhm.
we need to be very mindful of our physical health and how stress presents in that way.
And mentioning heart attacks is very important because for Black women, particularly, we often suffer from silent heart attacks. If you look up a silent heart attack, it looks very different from your traditional heart attack. Oftentimes, if you always say, "Oh, I got bad acid reflux or bad indigestion. That's if it's really, really bad and consistent, you may have had a silent heart attack. That's one of the actual symptoms. So it looks very different when you have a silent heart attack versus your traditional heart attack that we all think of, where you like grab your chest and things like that. So check in with your doctor, like Auntie Amber said. Always check for the possible medical conditions.
Y'all know what I love about doing this with y'all is that every single time I learn something new from y'all. I do. And I'm like, you know what? Maybe I need to go to my doctor and check on a couple of things too. Because, my heart been palpitating a little bit more lately. But I also... So I do want to add to that. Y'all know I always got to come from the kids' perspective and the family perspective too. As Black women, we are taught to be strong. And what strong means in our families is typically you don't break down. You don't get a chance to relax. You keep pushing through everything. You don't talk to nobody. You don't cry. You don't do this. You don't do that. All that makes you weak, essentially. And I'm not saying that's what it is, but that's what we're taught. And so when we become adults and we believe that, then we get into this really unhealthy pattern of trying to push through everything without stopping to look at like how we're feeling and tuning into ourselves and taking care of ourselves. And that's why, like, what I just learned a lot about the medical part too, but it makes a lot of sense too with that. If you're not stopping to take care of yourself, then medical issues tend to come in with that as well. So that was it's interesting to hear that. And
but sometimes Black people use the emergency room as their PCM, their primary care manager.
Yeah, y'all need to get a primary care for real. Primary care physicians are important. Very important.
And there's research to back that up. A lot of people who have anxiety and panic attacks go to the ED and not knowing it's a panic attack, but they go to the emergency department thinking it's a physical health problem, but it's really them anxiety. You all right, Kurt?
I'll be knowing though.
You know.
You are right. Oh, we got Abraham up here again. So, do you adjust counseling techniques or approaches based on the different ethnicities of your clients?
I like this.
Talk to me, aunties. What's up?
You should.
You should. At least
let me tell you why you have to. Let me tell you one of the reasons why we have to. So, because we have all these counseling theories, we have this that says if you're thinking this, then it might be this, or if you're thinking that, then it could be that. But we have different thought processes as Black people. So we are not necessarily paranoid when we stop at a stoplight and there's a cop behind us, where somebody else might be like, I was paranoid, and it might be paranoid because they're doing something wrong. Sometimes in a Black man, especially, you might stop at a stoplight and you might not necessarily be paranoid. You might be really thinking like, everything I see on the news, everything I've experienced, this could literally be my last breath. I remember being in the car one time and with Abraham, that's my husband, y'all. I remember being in the car with Abraham, and we were nervous when we got stopped. Now, I was speeding because I do tend to do that sometimes. But he was like, the officer asked him, "Can you give me your license and registration?" He asked, "Can I reach to the glove compartment?" And that's a very real thing to do when you are a Black man, because that can get you killed. And so when you have a Black man that comes into therapy, you cannot just look at him and say, there's a certain amount of paranoia when the cops stop him. You have to look at him and think about culturally where he might be and why might he be thinking that. Because some stuff could look like this person is deluded or or paranoid. But when you get certain people who have to deal with that on a daily basis, is not necessarily paranoia, it's reality coming to fruition for them at that moment.
Exactly.
So we do absolutely tailor it to ethnicity and what people go through.
And if you don't know what you're talking about or don't know how to specifically treat a specific client, you need to be consulting with someone who has worked with this population or referring this person to another clinician or therapist that has worked with this population before. And an example is someone just said it on Twitter the other day. She said you should not be working with people with eating disorders if you are not a registered dietitian. And I was like, I didn't think about that. But those are things that, or at least referring them. Well, no. She said you should not be encouraging weight loss or eating loss or something those type of things, because we're not dietitians. And I was like, well, she does have a point. I'm not a dietitian, but I work with people with eating disorders, and I should not be saying anything about losing weight. I'm not a dietitian. I
Right.
can refer that person to a dietitian, and we can collaborate together on how to best treat this individual.
Yes.
So even if you do it, Jess, and you don't feel confident and should know you're not confident in that area, you should be consulting or referring out.
Yes, this is where, again, it's important when you seek counseling or therapy, ask your therapist, your new therapist, what is your scope of practice? What can you actually work with and handle? Because a lot of times you can see a therapist for one thing, and like with like the example Auntie Keish used, someone with an eating disorder does need to have a dietitian on that team. So we can work in integrative teams with other professionals. You can have a therapist and a dietitian. So you want to make sure that the therapist tells you their scope of practice, what can they handle, but they definitely should be altering techniques based on ethnicity. Now, approach, I wanted to clarify because approach for me is a little different. My approach is typically the same with all of my clients. I adjust techniques and interventions and all of that for the client. Approach wise, I'm very direct. I tell all of my clients that in the first session. I literally describe my way of being as a therapist in the first session. I tell them I'm very direct. You are going to be made uncomfortable. You cannot grow without being uncomfortable. If you are always happy and smiling and comfortable, we are not actually doing work, because you shouldn't be. You should be able to sit and rest in that discomfort and grow through it. So my approach will always be direct, but the techniques I use and how I analyze clients looks very different depending on their ethnicity.
And I can't stand you because you took the words right out of my mouth. But anyways, I agree. Difference between approach and technique. So my approach is very direct. I can say for a very small number of clients, the ones that I really love and just like we doing some good work, we want to keep it going. If they do tell me I'm too direct, I might pull back on it a little bit, but I don't do the whole like psychoanalysis, braid around the bush, bring you back to like whatever connection. I don't do all that. Techniques, absolutely. I have learned through doing therapy that there are differences in like those collectivistic cultures, like the Asian cultures. Don't get mad at me if I use the wrong terms because I'm still learning as well. But like the Asian cultures and Hispanic Latino cultures, those are more collectivistic. So whereas like in individual therapy, you are working on the individual technically. These cultures, it's about the family unit collectively. So when you're trying to help that person work on themselves and they're worried about what their mom and dad and brother and sister, what's going to happen to them if they change this thing about themselves, then you do have to adjust your approach and your technique with that person to look at it from a different perspective. um, and it's different for individualistic cultures like us, Americans. We think about ourselves. Sorry, but we do. So it's easier to do individual therapy in that way because you're going to change yourself to make yourself better. And you're not going to necessarily, not always, but you're not going to be so worried about what the collective thinks, that you're not able to do that work. So that's just my input.
I want to give a caveat to that because this is also where our community, the Black community, actually struggles. We are Black American or African American, so we grew up in this individualistic society, but still the people that we come from, our ancestors, were very collectivist. So we still, I know a lot of us grew up with the "it takes a village" mentality. That is a collectivist mentality. So our culture, Black people, also do worry about what their family will think, what their mom will think, especially when it comes to religious trauma and things like that, or LGBTQ. We definitely worry, my community not going to accept me. I'm gonna be shunned, or I'm gonna be kicked out of the church, or I'm gonna do this, or my mom's gonna disown me. We absolutely have that. That's why we struggle, because the duality is we grew up in this individualistic society that told us get what's yours, worry about yourself. But some of our families were very collectivist. So we have both. And it's hard
Yeah.
to live in that tandem.
And I also, so that comment was more general about like everybody, but
Yeah.
also it comes down to the individual. So if somebody comes in my office and they're Black, I'm not just going to assume that they come from a collectivistic mindset. I have to get to know that person and know their individual perspective on life. Some of us do think collectively and some of us don't. Just depends on our experiences.
Mm-hmm. Mm-hmm. We got any other questions? Let's see.
I can't see the questions because my phone's dying. So
Android. See, the Android just be messing you up.
wait a minute. I have an old phone. It needs to be replaced. That's why, or else it'd be at 100%.
It's always got to be one auntie with the Android. Auntie with the Android.
It's an old Android. I just need to get a new phone. That's it.
So, Candace said, I
Sorry.
knew when I was angry every single day.
I was about to go back to that too. Yep.
So, you go ahead, Amber. You was about to hit
You
it.
good? Go ahead.
No, you got it.
We're going to make you talk, Amber. Go ahead.
No, I'm behind the scenes. I'm producing. Go ahead. Y'all good?
So, Candace, that's a good point. And a lot of people look at that as the angry black woman syndrome. And the reason why that's unfair is because typically when you feel like you're holding the world on your shoulders, I don't know happy people who has everything balancing on their own shoulders. And so when you know, like when you become angry, angry is an emotion. So some of us were taught that don't cry, I'm not strong. Um, if you cry, you're not strong. If you're angry, then you're an angry black woman. And so one thing Ashley said that I always love that she said is that it's like you're too much and not enough at the same cuss time. And so the reason why she says the cuss time, I'm not cussing.
Well, when you say cuss, you mean the
people
cuss
why you
word
saying
that goes
cuss.
in there.
Let them know because they're not
Like
going
the
to
fact that you
understand
said that and they have no clue what you
Like, what the hell?
like,
I'm
what?
saying at the same cuss time because I'm not cussing. So insert
Yeah,
whatever
the
cuss
same
word
damn
you want
time.
right there. Yes.
Translation.
So,
The same thing.
so with Candace saying she feels like she knew when she was angry every single day. Anger is a strong emotion. And so some people they don't go to sad, they don't go to crying. Some people go to angry. And that could also mean that you're stressed, depressed, anxious, whatever. And there's nothing wrong with talking to somebody even if you're angry because talking through that anger is really going to help you get out some of the frustration and be taught how to deal with stuff because sometimes people think that they're going to go in counseling and they're going to say no everything is fine and they're going to have this Bob Marley feeling where everything is all better, but that's not how it is. Sometimes we're teaching you how to literally deal with people on a day-to-day basis so that you're not angry and you're not projecting that out to the world because when you are, whatever you put out there you're going to get back and then it's just going to make you worse.
Let me I want to speak to anger for just a minute. In general, the way I work with the emotion of anger, I do not, I'm one of those therapists that you will hear say, I want you to feel your feelings. Feel your feelings. Don't push them to the side. Don't shove them down. Don't repress them. Feel your feelings. But a lot of therapists I'm starting to notice who tell their clients to feel their feelings want them to feel every feeling except anger. Anger is still valid. In a lot of cases, anger is still very much valid. You are allowed to be angry. We are allowed to embrace that and not judge ourselves harshly for being angry because usually we are justified, not all the time, but sometimes you are justified in being angry. So a lot of the work I'm starting to do with clients now is shadow work, embracing the shadow parts of ourselves, because the more we repress them, the more we are not embracing our whole selves. So if you are angry all the time, yes, we want to look into why that is and try to get to the underlying causes of your anger, the underlying emotions. Because a lot of times you'll also hear people say that anger is a secondary emotion. In a sense, it is, but sometimes you just angry. It's nothing under it. You're angry, but sometimes it's fear or hurt or rejection. A lot of other emotions could be under that anger. So we do want to get to that so you're not angry all the time. But I don't want people to walk away thinking they shouldn't be angry or can never be angry or it's this negative emotion. It's an emotion. It's a human emotion. We're allowed to be angry. Do not judge yourself for being angry.
Mm-hmm. But if you always angry,
If
seek
you're
some help.
always angry, that's when you know it. Okay, maybe I need to talk to somebody. Maybe I need to figure out what's under this, what is causing all the time anger. But sometimes you can be a little bit pissed off, and it's okay.
See, I knew I ain't had to say nothing. Y'all got it. See, look at that. Because what I was gonna say is sometimes we think we're angry, and it's actually a whole lot of other stuff coming with that, and we just lump it all into anger. Because I know when I'm hurt, when my feelings are hurt, it comes off as anger, and like I'm yelling, like it's bad, but actually my feelings are hurt. And if that person just apologizes, then I'll be like, oh, dang, you knew my feelings were hurt. All right, cool. So that's what I was coming with. But y'all got it covered. We got a question here too.
A lot of times I'd rather cuss you out than let you see me cry. If I cuss
There
you
you
out,
go.
it's easier than you seeing me cry. Crying is vulnerability. Anger is different.
That's a protection right there.
Yes.
So what do y'all suggest a person does when they're too tired or depressed to even attempt therapy? What's the first step?
That depends on what kind of tired or what kind of depressed you are. For me, there's always a why. Why are you too tired? Why are you too depressed? That's why I got into psychology, because I always want to know why. And so if you're too tired physically or if you're too tired mentally, those are two different things. Because physically, you might need to see your doctor. And then 9 times out of 10, if something is not wrong physically, your doctor's going to say, well, are you going through something? Have you been talking to somebody? And then you might be directed to therapy. But when you're too tired or depressed to even attempt therapy, that's kind of coming into dangerous waters, because what is your other coping mechanisms? That's the question that you should ask yourself. So the first question I would ask myself is, okay, if I'm too tired to even attempt, what am I doing to help myself? Yeah, you ain't got nothing.
Well, I'm gonna be honest. I'm sitting here looking at Keish because I'm like, she ain't said nothing in a minute. I'm waiting on her to hop in. I'm always gonna call you out when you quiet for too long.
Too tired to say something.
Too tired. Come on now.
Is this person, I don't know, I started thinking, like, is this person depressed? Is that what it is? Or are they fearful of what's going to happen if they try to go to therapy? Like, what's holding them back if they, I mean, unless this person was like clinically diagnosed with depression and we know exactly what it is, what if they're avoiding therapy? What if, they don't trust therapists? What if the therapist they've went to before, the therapist has harmed them? So, and on top of that, when you try to get people to do things they don't want to do, sometimes it can be difficult to push a person in a direction. Sometimes you have to meet them where they are. And sometimes that means, hey, it's okay if you don't want to go to therapy. How can I help you in the moment that you're in right now? And maybe we'll eventually get there. So it may take steps, because maybe somebody has never been to therapy, don't know what to expect. And so taking a step to go to therapy means that you're asking someone to be vulnerable. And sometimes being vulnerable is something that could be the hardest thing someone has ever done, because when they have been vulnerable before, it didn't work out or it wasn't helpful. So I don't know. That's all I have to add since Amber called me out.
See, I knew you were gonna drop a couple gems in there. Actually, I think you're on mute.
I'm just a talking. I went on mute because the dog started barking and I forgot to turn it back on. I'm just a talking. I was more aligned with what Keish just said, because the first thought that actually popped into my head with this question was, are they avoiding it? Are they saying they're too tired due to wanting to avoid it for some other reason? And then the next thing that popped into my head was accountability, which may seem strange for this question, but it was like, my question would be, are you going to work every day? What other things are you doing? Are you too tired for those things as well? Or is it just therapy? What else are you too tired for? Because if you're able to do everything else and push yourself through that, then it's not that you're too tired. It's more of a fear there, or an avoidance.
And why?
And why?
Yes, the why. I just to tack on to that too. So if we're assuming, or if you believe that it's not avoidance or anything, and you actually are too tired or too depressed to get up and do anything really, then there are things that you can do. Did we have an episode on it? No, we recorded it. I'm sorry, I'm tripping. But there are things you can do to kind of get some of those feel good hormones going in your body. So you have the dopamine, you have the serotonin, you have the endorphins. I think that's what it's called.
Name them all. You named
all
them
of those make you feel good. So the way that you get those going is doing things that you enjoy or that you used to enjoy. And while it might not feel as enjoyable now, so let's say you used to enjoy reading and now you just feel so tired and so depressed, maybe just pick up a book and start reading just to see if you get any kind of feeling from it. You may not feel like super happy like you used to, like all into the book, but you'll get a little something. And the more that you do those small things that bring you enjoyment, the more of those feel good hormones you'll get. And maybe you'll have a little more energy, just a little bit, to get up and do something that's on your list to do. Um, and
Don't be afraid of medication
We call
either.
that behavior activation.
yeah, there you
Good
go.
job.
Clinical term.
I do want to say this.
So I gotta break it down like that. Go ahead. Sorry.
No, I wanted to touch on that and before because we have another question next, so I'm gonna hurry up. But some people are afraid of medication. We have been told in our community, don't you let them give you nothing. But that's crazy. And the reason why I say that is because some people, this is not me diagnosing anybody, but some people have genuine feelings of not taking medication because it makes them weak, or God told me not to take medication, which neither of them is true. Because if you're a spiritual person, God gave you doctors. You won't go anywhere with your hands hanging off your wrists, because you will be looking for somebody to fix you and give you some medication for you to make it feel better. Your mental is more important because you literally need your mental to function every single day. And so if you feel that you have something broken inside of you, it's okay to get you a little pick me up to maybe have it fixed, because some people have lower serotonin. And so when Amber was talking about serotonin, what she's talking about is the feel good drug. Our bodies naturally produce serotonin. Your brain naturally produces it. Some people have lower levels of serotonin. And so some people might actually need medication to maybe make them feel what people call normal.
Mm-hmm. And for those on here that might be, against medication for reasons such as, big pharma, and of course they want you to take medication because then you'll become dependent on it. For those
Mhm.
that, yes, that is true, and that can be true. And I am one of those therapists. I'm not against medication at all. I'm all for if you want to try other things first, if you want, but there's certain diagnoses where you will need medication. Um, but natural methods too, like Shug said, if you, even years ago, if something happened to you, even if you went to the neighborhood herbalist, you went to somebody for something. So if you want to try more naturalistic homeopathic paths, that is fine. But sometimes that will not suffice for every single mental health issue. So to just totally throw out medications altogether may not be a good idea in some instances.
Mhm.
Yeah. I'm gonna skip around a bit, but we got this question, a really good question. What are your thoughts on mass shootings being considered as a mental health issue? How do you know it is actual mental and not just evil? And I know our girl Keish is gun violence
I am.
all over it. So what do you think about that, Keish?
I'm all over it.
Pull up a chair.
It's so interesting because this is always a hot topic. Whenever a mass shooting happens, the first thing people say is mental illness. And so we want to make sure that we are very clear that just because someone has a mental illness does not mean that they are violent. And a lot of people try to put those two together. So when it comes to mass shootings, it does not necessarily mean that this person doesn't have a mental health history, because they may, but that does not equate to they did the mass shooting because they were mentally ill. Those are two different things. And
Mhm.
so I would say that my thoughts on equating, like correlating both of them, is not always the case. Someone can just be pure evil
Mhm.
and purely just having a moment and they just snapped and that was it. So, and to put this in a better context, in 2021 or in 2020, 41 million people were diagnosed with anxiety. So if everybody was violent who had a mental illness, the country wouldn't even exist, because 41 people would be out there shooting up the country, when that is just simply not true. So what do I think about it? I don't think that there's a correlation. Um, and there's plenty of studies out there. One lady did do a study; she broke it all the way down with statistics. But yes, Just because there's mass shootings does not necessarily mean it is mental illness is the cause of that.
Let me tack on to that too. The very first time somebody mass shoots up a school, the first thing that people want to say is it had to be mental illness.
Right.
And or this person has autism or this person has ADHD. And the difficult part in that is a lot of people have not even did a psych eval on this person. And so honestly, unless we did any kind of psych eval on this person, you don't know whether it's a mental illness. And even if it is a mental illness, everybody who has schizophrenia, autism, ADHD is not out shooting up people and killing people.
Correct.
And so really the person should be treated as an individual on all aspects. There could be evil or there could be a mental illness or there could be both.
Mm-hmm. I saw this question when it popped up, and I was like, I'm not even sure I want to touch it because I get angry about this real quick. So I'm like Auntie Keish. I don't believe that there's a correlation. Can a person who does a mass shooting have a mental illness? Yes, but a correlation, there is not one. Simply because, like she said, a lot of people have mental illnesses. Statistics show that you are in less danger with someone with a mental illness. So most people with mental illness are not violent. They're not. And this puts a really negative stigma on mental illness. My thing is, I always tell clients this: your mental does not justify your negative behavior. And it never will, because you can do the work. There are medications, there are all sorts of things that can help with it. Now, is that saying that everyone has good impulse control? Not at all. But we can't continue to say, oh, their mental illness caused them to do this. No, it didn't cause them to do this. This is something that they, like some of these recent shootings were very much planned out thoroughly. So it is very hard for me to say, yes, their mental illness caused them to do this. No, they planned this out. So no, it didn't. It's not a correlation, but they do have a mental illness that could have maybe triggered some things. It could have triggered some things in them, but it didn't cause it. For the most part, I'm more of the it's just pure evil, but that's me. Like Auntie Shook said, we can't diagnose them. So we can't sit up here and say, oh yeah, he's this or that, and this is why. We don't know. We haven't worked with them individually. But there's just not a correlation. That's all.
The last two mass shooters had manifestos, and they got their information from different websites, different places, and actually looked those things up and wrote an entire manifesto as to why they did what they did. And it sounded more of I was influenced by someone and I carried out these actions, not I'm mentally
That's
ill.
malice of forethought.
This is in my head. Would you say, Shook?
I said that's malice of forethought. You had that malice in your heart on your way to go and do it.
Right,
Yeah.
right. They were
So
influenced by people. So
we have two more questions, and then we need to wrap it up. So save some questions for next time, next month, same time, September 14th.
Is that right, Amber? Amber got our.
I got you. I put it in the comments too. September 14th.
Yes.
Okay.
So the next question is from Abraham, our biggest fan so far. Woo, go ahead, Abe. We see you. What are your thoughts on exposure therapy?
I have used it. I have used exposure therapy. A lot of times with the phobias, if you get diagnosed with a specific phobia, exposure therapy is one of the really used techniques for phobias. And what it is it's just exposing you to the trigger little by little, though. It's not like you come in and tell me you're afraid of spiders and I bring in a bucket of tarantulas the next session. No, that's not how that works. But slowly exposing you to it, like maybe starting out showing you a picture of a spider in a book or reading a book on spiders if that's your fear. Whatever your fear might be, whatever your phobia might be, we want to slowly expose you to it to decrease the anxiety that rises when you are triggered. So that way you can become used to it. A lot of people use exposure therapy with fear of dogs because dogs are people have dogs as pets. Our family members have dogs, friends have dogs. And if you have an extreme fear of dogs, it might literally stop you from going over somebody's house that you care about. So we want to expose you to it little by little so that you become less triggered in that situation and you are not instantly placed in fight or flight mode.
And so with exposure therapy, there's a little bit, I'm gonna tack on a little bit more to that. She's absolutely right. But you also expose and then you have to pull back a little bit because when you're exposing, you're creating the trauma in the person, and then you pull back while you're teaching them how to deal with the physical symptoms that may arise while they're being exposed to that trauma. And then at the end of each session, just in case people go to sessions and they're scared of exposure therapy, you're always brought down before the session. We don't just expose you and then put you out in the world.
Yes, we do grounding techniques. Before an exposure therapy session is over, we will do a grounding technique to kind of regulate your emotions and bring you back down.
And regular people shouldn't be doing exposure therapy. Don't be out here just exposing people to stuff because you feel like they need to be exposed to some stuff so they can get over fears.
Yes.
I believe exposure therapy needs to be done with a trained professional.
Yeah,
Who's
not
the
you.
regular,
No.
what regular people y'all know out there doing that?
You ain't never
Oh,
had
listen,
friends
that's
tell
what I'm
you
saying.
that?
No.
Parents, a lot of parents use exposure therapy with
They
their
will throw their
children.
kid in a pool in a minute and be
Throwing
like,
their
I put
child
him
in
in
a
there.
pool.
Do they know that that's what they're doing, or
They don't know that that's what they're doing, but that is what it
okay.
is. So,
Oh,
like,
okay, because I was like, I thought you meant like they were intentionally out there doing this.
no, with the fear of dogs, that's a really good example because I've actually seen parents, if their child is afraid of dogs, they're like, come with me, walk with me, and come pet the dog. It's like, no, you can't just take the child and go pet the dog if they in fight or flight mode and totally petrified. You can't do that. But they try to
traumatize them.
Yeah.
You're gonna traumatize them doing that.
And if you think about it, swimming.
I was gonna say I don't do exposure therapy because I'm not trained to do it. Well, I don't do it for trauma and things like that. I'll do it for like anxiety, like minor things. But I don't do it for the real deep core stuff because I'm not trained to do that. But yeah, I have had friends in the past that will tell me like, "Oh, you scared of that, girl? Just go ahead, go do it. You just gotta keep doing it, and then you're gonna be fine." I'm like, no, because the more I do it, the more anxious I get, and now I'm about to have a panic attack. I can't do this. So it really is like Sugar saying, like, now that we're talking about it, if you recognize that you're doing that, please stop. Please take them to a professional who is trained to deal with it. If this is not trained to do it, then have them refer you to someone who is, because you have therapists out here too who will try to do things they are not trained to do. Like I said, I'm direct. I'll straight up tell my clients, like, I do not have that training, but I know somebody that does, and I got you. Let me go ahead and refer you. But yeah.
And please don't go out here and Google the steps to exposure therapy and then think you can do it. That's not how it works. Okay? Don't go out here Googling stuff that we say and like, oh, this sounds simple enough. No.
Okay, so we got our last question here.
Ooh, so this is from Venetia. Another question from her mom. Now that we're all adults and her kids are also, my oldest sister has a hard time not parenting us. She was put in the mother role at an early age. How do you move on with your life?
Ooh, that's a
That's an Amber question.
Oh, hold on. I was responding to a comment. We're adults and kids are outside. My oldest sister.
This is family dynamics.
Oh, this is like parentification. Let me break it down for you. All right. So, how do you move on with your life after that? So, if you're asking, how does your sister move on with her life and not parent you?
Her mother. It's from her mother.
So the question, can y'all tell me what the question is asking?
She's like, now that we're all adults.
Her mom's asking, her mother's asking, because of the oldest child, I believe, is more parentified than the other children and parent them. She parents all of them.
I think this is the mom's oldest sister. This is Venetia's mom's oldest sister who parents all of her siblings still, even though everybody.
Oh,
yeah.
Okay, somebody else has to start. I was lost because I was in the middle of a comment, and that's why. Somebody else start, and I'll pick up on it.
So there are roles in every family. And when you start, you like, and I'm gonna this gonna hit Ashley. I'm sorry, Ashley. I still love you. I'm gonna give you some examples. You get only children, and they don't know how to function. And not all only children. A lot of only children only know how to function in a space by themselves. They might not know how to share. They might know how to share. They might not know how to be around other people. Not be around other people, but how to function in certain settings. You'll get older siblings who have been always been told, you're in charge, and they have a hard time not being the boss. You'll get middle children who always, everybody heard of middle child syndrome, where you always feel neglected. And so you feel like you're constantly struggling for attention because nobody can see you. They're taking they're always looking at the oldest child who's doing everything first, or they're looking at the baby because the baby's so cute and it's the last time it's ever going to be seen. Or you might get the baby who is so babyfied that people feel like they can't do anything on their own. So there's different roles in family. And so what she's saying is that her older sister has been put in the typical older sister role and won't stop bossing everybody around.
Yeah, so she clarified. She's asking, how does the oldest sister move on and stop parenting people?
Mhm.
Um, yeah, that's it's hard because it depends on how old this person is. So if this person has been parenting all this other siblings for most of their life, if this is an older person and they've been doing it for 20 or 30 years, then it takes a lot to reverse or kind of unlearn that behavior. It's a natural reaction now to everything. It's a natural response to want to parent because that is like nurturing, caring, and that's who that person has become. So a part of that is identity, right? If you have been identifying as a parent, if you're not a parent and you've been identifying as a parent because you've had to do that with your siblings for a really long time, then you need to either add a little bit more to your identity, explore your identity a little bit more, and get to know more about who you are. A lot of us, we stick to like one thing, like I'm a parent, I'm a mom, and that is what I identify as. And so when I don't have that anymore, I feel a void, I feel a loss, I don't know what to do. So it goes into finding what else is there about you. You're more than just a mom, or you're more than just an older sister who can parent. There's so many other things about you. You explore those parts of your identity and you start to do things within those other parts of your identity, if that makes sense, instead of just focusing on the parenting. If right now you were to try to take that parenting away from her and say, you know what, you just need to stop. Like, that's it. You're too old for this. You just need to stop. She's going to struggle with that. That's a loss for her. That's a loss of who she is, a big part of her that you're asking her to shut down. And that's hard to do.
I also think for your mom and for the other siblings that she is still, trying to parent, their part of it is someone can say something to you and that doesn't mean you have to take it in. So their part is recognizing this does still affect me. She has said something trying to parent me. I do not listen. She can say it, and I'm not going to try to pull her out of that role so instantly that it causes her trauma, like Auntie Amber said. But I can just, not. I can listen and say, okay. Sometimes we can just say okay and keep it moving. We don't
Mhm.
have to actually listen to what a parent or someone who is trying to parent us as an adult is saying to us. We can be respectful. We can say, all right, I got you, and then go about your life. It's okay.
But at the end of the day, you can only control yourself.
Mm-hmm.
So one thing that Auntie Ashley is hitting on is accountability for oneself. So if this person is constantly saying something to you, you're not going to be able to control what other people say to you, but you can't control your reaction. And so I found a meme and it was so perfect for me because I've never liked to argue. I'm not in the space for it. All of this, I can't handle it. And so if somebody's wrong, I just let them be comfortable being wrong. And then some people get louder when they're wrong. And then I'll just say, now they're loud and wrong. And so sometimes you have to allow people to be loud and wrong and move on with your life because you don't have time to take in what doesn't serve you.
Mhm. I saw that meme and I was cracking up. It said, if you tell me 5 + 5 is 1, I'm gonna be like, yep, you correct.
Go ahead,
I
have
have
it.
a problem with that because I preach to my clients about advocacy, speaking up for themselves. I have a problem with that, with just not doing that. So I get it to a certain extent, right? To where you don't want to cause too many other problems. But if you've got someone who is, and I'm not saying that this older sister is doing this, but if you have a sibling who is like talking down to you as if they're the parent, they're better than you, they know more than you, and you just say, okay, yeah, cool, and then go on about your business, like, no, you can speak up in a respectful way, without like being rude to that person. But I encourage people to speak up and advocate for themselves as well. There's two sides to that coin, I guess, is what I'm saying.
Yeah. Well, she's saying that this woman is 70.
She said 70.
So,
Oh,
so 70 years of you being loud and wrong. If I want to maintain
who
my
said she
peace,
was wrong though? That's the thing. Who said she was
but what
wrong?
she's
She was
saying is
put.
that
She was
she's parenting them. When
because
anybody
she
but
was
a
put in
parent,
a mother role at an early age. Did you see that part?
yeah,
So
put in the mother role, but didn't birth her. So if she didn't come out your pie, you're not the parent. And
okay,
so,
so you telling me that
Mm.
aunts and uncles and mom's friends they don't have they can't
You
be part of the
struggle
village
with
to
that.
help with parenting?
she's asking, how do you move on with your life? She's not.
Right.
She's not asking, how do I engage with her? She's saying,
Yeah.
how do I move on?
No,
And
but y'all were
she's not asking how do I change my sister. She's saying how do I
How
go.
do I move on?
Something you said, Amber, that I want to just touch on before we get off tonight, the advocacy part. So there's a
I'm
difference.
sorry. Can I just say somebody just loved the pie as much as we love it?
The
I don't
pie.
know how to say it. Tashawana. I'm sorry if I butchered that. Talking about your pie because Suge always talking about somebody pie on here. Sorry. Go ahead, Ash.
So the advocacy part. So there's a difference. Even a parent of a child should not be talking down to that child. So if somebody is talking down to you or disrespecting you, that's not always the same as trying to parent you. This woman could just simply be trying to tell you what's best for you, trying to tell you what to do, trying to tell you how you live life right now. That's different. You can just say, all right, I hear you. I'm taking it in, and just say, okay, and walk away to keep your peace. If somebody's talking down to you, I don't care who it is, you advocate for yourself. I strongly support advocating for yourself if somebody coming at you the wrong way.
And you could take the meat and spit out the bones.
Mm-hmm.
Take
Because
what you
something
want.
you said could be right. Something she's trying to tell you could absolutely be right. So take what's right and go on and tell Auntie, all right, I'll see you tomorrow. I'm done with this tonight. And just keep your peace.
Well, Auntie can learn how to move on. Tell Auntie to go to therapy and explore her identity and learn more about herself, and then she can go from there. Like that's a very powerful thing, but you gotta get a therapist that can actually help you do that work too. Because not everybody can go that deep.
Right. But Auntie is also 70, so she might be set in her ways. And that's
Yes.
okay.
See that
Leave
I
it
don't
alone.
work with people 65 and older because
I
I've
have.
had so many times where they're just like, no, like you are wrong and I don't want to hear it. And I'm like, look, you can't be me, right? Like I can't do this.
I had a 68-year-old client say, you young enough to be my granddaughter. Like, how you gonna help me and tell me what to do? I said, because I'm not your granddaughter, I'm your therapist, and that's what you came here for. So either you take it from this younger woman, or you find yourself a 69-year-old therapist so that you feel better about yourself. This is what I mean when I say I'm direct. I don't play that.
You ain't tell nobody that.
I believe her.
She knows. I'm real upfront with my client. I'm real straightforward with my client. She already know.
All right. Well, our next live is going to be September 14th, same time, same place. We might add, are we adding YouTube that time? We might add another platform, but it's definitely going to be on Facebook. Thank you, everybody.
Thank you. Oh, and do we have a new episode dropping Friday?
Yes.
We do.
Yes, we do.
Hold on. What episode is this? Episode 3?
This is episode 3, code switching. Code switching.
Oh, and that's a good one too, y'all. It's good.
How code switching affects our mental health.
So if y'all could, everybody who was on here, like, subscribe, share, go on our YouTube page. We are on Spotify. We are literally we're on Instagram, Twitter. We on Twitter, y'all. Go ahead and follow us on everything, like us on everything, and just share us. What'd you say, Keish?
I said TikTok.
TikTok. Just share us to people. I think a lot of people on here today might have got some good questions answered. And if you guys had so many questions, there's more like you.
Yes, and just also know we're always open to suggestions for future episodes. We started off with a whole list and we haven't even touched our list because we've been taking suggestions from the viewers and doing those topics. So if y'all ever have any suggestions, just put it on any of our platforms, DM us or whatever, and we got you.
Yes, sir. Yes,
Last
ma'am.
thing, do we want to sprinkle in and tell them about little minis that might be getting soon?
Go ahead. Go ahead.
All right. Y'all might be getting some little mini episodes. These are not full hour-long YouTube drops. These are just little 10 to 15-minute segments. Sometimes it'll be with us together. Sometimes it'll be with us individually. And those will be special. The individual ones are catered to each one of us and what we specifically want to talk about. Okay. So keep an eye out for that.
Y'all gonna get mine after my dissertation though, because I ain't got time.
She ain't got time. She ain't got
All
time.
right. Thank y'all so much. This was fun.
Bye, everybody. Thank you.